Good afternoon and welcome to our Expand webinar. We are now on the fourth edition of this series of webinars. And today we have very special guests to discuss an angle that is a very provocative angle, which is, what would happen, where would we be if we don't get the exchange format out of the regulation. That's my understanding of the challenge to my invitees. For today, I have the pleasure to moderate this webinar. I'm the XpanDH coordinator. We will have policymakers from European Parliament, European Commission, and a representative from eHealth Network representing member states from France. We'll provide updates on the EU European Health Data Space legislation and highlight the strengths and the importance of this ambition, the European Health Data Space, for patients, professionals, and researchers in Europe. We are going to also sort of explore how this regulation is important for the exchange format, but more broadly have a discussion around this important piece of work. We will have time for, after three panel presentations, to stay a little bit longer. Unfortunately, MEP Tomislav Sokol will not be able to join in the discussion part, but I really thank him for being present in our panel. But we will have two of the speakers, Dr. Konstantin Hyppönen and Ms. Isabelle Zablit, to discuss with us the need for data standardization, including the exchange format, in how we are going to reach this health data portability and transferability across settings, regions, and countries in Europe. This event will last 1 hour. Our webinars are always recorded on Zoom. They will be released as recordings, providing a valuable resource for anyone else seeking to stay informed about the latest developments of the exchange format and, of course, its underlying legislation. You are welcome to participate by posting your questions on the Q&A. And this is very important, as it will make our discussion much more fertile, much more interesting. So do not be shy, participate. This is a webinar for you. And this allows me to emphasize and thank also the organizing team behind our webinars and the consortium in more broad terms that constitutes the XpanDH project, which is a coordination and support action to help promote and develop and sustain the efforts in Europe on the European electronic health record exchange format. So I will really use the time to invite our audience to follow now our panel discussion and presentations. And I see we have MEP Tomislav with us. So I would like you to please prepare to take up the floor. He's member of the European Parliament, group of the European People's Party, and therefore over to you. Thank you very much. I see that we have a notice that we unfortunately don't have him yet on our call. So I would ask Dr. Konstantin to please take the floor. And Dr. Konstantin Hyppönen is policy officer from DG Health and Food Safety, known as DG SANTE. We'll be speaking about, well, I'm not going to say everything you're going to be speaking about, otherwise it's no surprise for everyone. So over to you, Konstantin. The floor is yours. Thank you so much for taking the time to join us today.
Thank you so much, Henrique, and good afternoon, everyone. Happy to see so many people around this webinar. I think this is not my slides, though, and I hope that my slides would be okay. Now it starts. Today I would like to speak in a more positive way about the upcoming European health data space, and also about the position of the European electronic health data exchange format as part of that upcoming regulation. And of course, the regulation is to resolve some challenges, and the challenges are very known to everybody. It's people having difficulty accessing their electronic health data, having it follow them if they happen to travel or change healthcare providers. And we get a similar message from the health professionals. They still have difficulties accessing health data. At the same time, the manufacturers of different electronic health record systems are facing barriers when they are entering different markets within the European Union, facing different formats they need to implement. So there is indeed a lot of need for harmonization in the language used for the exchange of electronic health data. And of course, there are challenges in the domain of secondary use. Policy makers, regulators, researchers, and other users, potential users of health data, unfortunately have difficulties getting to the data that they need, and then this limitation of research and innovation possibilities is having its own toll on what is possible to achieve in a broader context. And that's why the proposed EHDS regulation has its own elements. If we go to the next slide, we will see that it's one and the first European data space. It's the first sector-specific data space, which is for health, and more are upcoming. And of course, also the interaction between different data spaces is foreseen, and we are exploring the possible synergies. As we know, for instance, researchers, when they use the data from the health domain, they may need to combine that data with maybe environmental factors in order to perform some research as to how environmental factors are impacting health. So things similar to this are being examined. We are not building the European health data space from an empty table. In fact, a lot of work has happened already, and on the next slide you will see that we are having already multiple member states, 12 member states connected to the cross-border electronic health data exchange infrastructure for primary use. It's called My Health at EU, and on a daily basis, people are getting their prescriptions dispensed or having their patient summaries viewed by doctors and other health professionals in other member states when they travel there. So we are working hard on getting the geographical coverage of this infrastructure to cover all member states and also to extend the services to include things like lab results, medical images, hospital discharge reports. On the next slide, you will see that for people, it's actually very easy to use the infrastructure. They can, for instance, get a prescription in one member state and simply go to a pharmacy in another member state without so much even interacting with digital health data. They can bring their passport and or ID card and get the prescription dispensed. Everything works with even very limited digital skills. For some people, this is really important that they can benefit from digital health without actually using computers. But We are extending also to other domains. So on the next slides, you will see that we are exploring the possible interactions with the EU digital identity wallet technology. So there is a large-scale pilot ongoing to examine the e-prescription use case more specifically and to make it possible for even further standardization in that domain to happen. The vision could be as easy as a person having a EU digital identity wallets and access to prescriptions through it to come to just any pharmacy in the European Union and get that prescription dispensed. Also, we are exploring the possibility for citizens to get access to their health data, to the translated health data in My Health at the EU through the pilot on patient access. With EHDS regulation, on the next slide, even further possibilities could be opened for expanding this infrastructure. So there would be a possibility to also link up third countries, national contact points for digital health there to the same infrastructure and enable exchange of health data if citizens go there or citizens of that country come to the European Union. There would be also a possibility to expand the infrastructure and connect to some other infrastructures, maybe the ones set up by the World Health Organization or some other international organizations. And why all that is becoming possible? Well, because of the envisaged European Health Data Space regulation at the legal level. And we all really hope that the adoption will be not so far in the future, but rather very soon. But also at technical level, that is an important element which is included in the text. And on the next slide, you will see the main article in the EHDS regulation proposal. It's Article 6, which is entitled European Electronic Health Record Exchange Format. It's essentially a language for exchanging data. And in all the use cases, in all that infrastructure I was explaining before, of course, it's that language which is used for getting the data through exchange between different actors within that context to get the data, follow the patients if the patients go to different healthcare providers. So it will define the data sets, coding systems and values, technical specifications for the exchange, content representation, standards, and so on. And again, this is not something just upcoming. Sometimes in the future, we use many elements of the European Electronic Health Record Exchange format already today in the My Health at the EU infrastructure. Now, let's take a closer look as to what could happen with the format thanks to the European Health Data Space regulation. On the next slide, you will see the basic infrastructure architecture, which is centered around national contact points for digital health. So here on the left-hand side, you can see a patient going to a doctor in country B, and then the data is fetched from country A. Now the format is used between the national contact points in this picture. It's the national contact points exchanging and forwarding the data so that the health professional helping the patient can actually get access to the required data. However, it's of course also possible to use the exactly same format in the national context. And we all know that currently there is a lot of different national implementations and systems using different languages, different formats for exchanging exactly the same types of medical information. So we hope that with this increased harmonization brought by the European Electronic Health Record Exchange format, we'll see more harmonization also in the languages used within the member states for exchanging the data, which is quite commonly very similar in different member states. So if you click here, I think there should be some animation, very simple one, or at least some new elements. Oh, that's great. So in the EHDS proposal, you will see also those possibilities for using the format within the member states. For example, people can download their data in this European format, and then they can submit the data, send the data, make the data available to the healthcare provider of their choice. So such acceptance of health data made available by the patients, it's also one element in the proposed regulation. And of course, the issuance of data in the format, getting the data downloaded for yourself for future use, that is also included in the proposed regulation. And further opportunities are lying within the national infrastructures and within the individual electronic health record systems to use the format to further harmonize the exchanges of data between those different products and within different member states. I think I'm very close to the end. I just wanted to show one more slide explaining that we not only have all these previous developments, but we also have a lot of developments upcoming. It's a slide summarizing the actions related to the development of the European Electronic Health Record Exchange format. And you will see that it's indeed starting with innovation, experimentation. However, after some time, when things get more mature, there is formalization of the format. And this is where we're working in the eHealth network and in the joint actions and preparing the upcoming implementing decisions under the upcoming EHDS. And then the formal descriptions are possible to deploy within different infrastructures. So in the cross-border case, that is My Health at the EU. However, of course, the deployment is also possible at the level of different software products and at the level of national implementations within member states. So my message to you today, just to summarize and wrap up, is to say that at least myself, I see the format as one key element in the European health data space, because it's one of the main enablers for getting data flowing, for serving our citizens and health professionals, helping them. But also the use of the format will be very useful and important for enabling harmonization within the domain of secondary use as well. So I think more actions on the format are still upcoming, but we use already the format, and we really should be happy that it's already functional and it can be even more useful, could be made even more useful thanks to the upcoming European health data space. I stop here. Thank you very much, Henrique, and thank you very much, the whole audience. Over to you.
Thank you very much, Konstantin. Thank you for your presentation and informing us on the European Commission work and also the vision on how these developments are linked to the regulation. And I would like to invite now MEP Tomislav Sokol to share with us his perspectives. As I mentioned earlier, he's a member of the European Parliament, group of the European People's Party, and we are very happy that you have taken the opportunity and the time to be with us, and especially with our audience. They are free to send questions over on the Q&A. I know you may not be available at that time due to your busy agenda, but we will make sure that we can then later on try to find a ways to address them. So thanks very much, and the floor is yours.
Thank you very much. First, I would like to thank you for inviting me to speak about a very important topic. I have to apologize that I will have to leave right away because I have 2 additional events on EHDS in the next hour and a half. So you can imagine that a lot of work. It's a big important issue now in Brussels, which is a good thing because we are very close to finalizing the political agreement within the European Parliament, or I should say we already have it. So since in the introduction a lot has been said from the part of on the part of the Commission about the EHDS, I will not go into the technical details that much. I will focus on the current state of play, on the most controversial issues within the Parliament. So where we are now, I think this is probably something that will interest the audience the most. So the current situation is that that we reached a political agreement within the Parliament on most important issues. Now we are finalizing technical work so that we have the vote in the respective committees on 28th of November. And then to have the vote in the December plenary. After that, we'll try to start the trialogue with the Council and the Commission right away. So this is very important that we don't lose time, because we don't have a lot of time if we want to finish this before elections. And the Parliament will work until the end of April. But I heard that the Council plans to finish the political trialogue sometimes in February, which means that really we do not have a lot of time. So it will not be easy, but I think it is possible if everybody is constructive to reach a political agreement so that we have this before elections. If we do not finalize the negotiations before elections, what will happen that we will lose at least 7 to 8 months after that. So because if you finish in April, that's great. If you don't finish in April, then we'll have European elections in June. Parliament will be constituted in the middle of July. Commission probably in September. So we will not start the work again until October or November. That's certain. Which means a lot of time lost, for the implementation, and this is something that we should definitely avoid. So that was on the procedure. On the content, so primary use of data, so use of data by healthcare professionals was not considered to be that controversial. They didn't have a lot of points of contention there. One point of contention was about the electronic health record and the system of assessment, whether it should be a third-party assessment or of these systems or self-certification. And in the end, the majority in the Parliament, because of the reasons of safety and quality and achieving common standards, was in favor of third-party assessment. So this is what was decided. On other issues, there was a debate on the question of wellness apps, whether they should be excluded or not, and the position prevailed that wellness apps should be included. Of course, this data is not of the same value as clinical data, which is fed into the system by healthcare professionals, but this data can be useful for different purposes. So we should make it clear. So it should be made clear in the system that this data does not originate from clinical, from the hospitals and from healthcare providers. But if so, this has to be made clear. But then those who might think that this data can also be useful for them will be able to use it. So the idea was not to prohibit the use of this data, but to inform potential users about the potential lower quality of this data from wellness apps when compared to data fed into the system by medical professionals. But let them make up their own mind. If they think that this can be useful for them, that's fine for us. Also, the question was about the possibility to restrict access to some of the data. So, for instance, if a patient who has some kind of a mental health condition does not want that his or her general practitioner maybe see the mental health problems, or maybe if a patient goes to a gynecologist, so that patient does not want the gynecologist to have access to his or her mental health data issue about mental health conditions, etc. So these kinds of things. So this is something that you already have in the proposal. The question was whether medical professionals should be aware of the fact that there is this restriction. I personally was in favor of of notifying this to the doctors. So not on the actual content, but of the mere fact that some data has been restricted, but the majority in the parliament was against that. So as it turns out now, there will be, the medical professionals who are treating patients will not be made aware of the fact that access to some of the data has been restricted. Again, I said I was in favor of notifying this, making this information available to the medical professionals, but the majority in the parliament was against that. On the secondary use of data is much more controversial. So because this also includes not just use of data by this secondary use of data means use of data for other purposes than healthcare treatment by some other people, not healthcare professionals, not by doctors. And of course, what is controversial for some people in the parliament is that this also applies to industry, that industry will also be able to gain access to this data. But we think that having industry, both private sector and public sector, so universities, research institutes, industry, policymakers, that they all have access to this data is important, because we cannot develop new medicines without the industry. And for that reason, we believe that it's important that everybody who has justifiable purpose to access this data can do so. What was also important for us is to more clearly define, when compared to the Commission's proposal, the purposes for which data can be used, because there was a lot of misinformation floating around in the internet on that. I even saw some headlines in some online portals that we will hand over our personal health data to big tech companies like Facebook, Google, etc., which is definitely not true. So, but to make these claims disappear, so we really defined the purposes for which data can be used for secondary use in a much clearer extent. So made it clear that it has to be healthcare, that research innovation that has to be related to healthcare for public interest, and that it needs to bring benefit and aim to bring the benefit for the patient. So by doing that, we made it clear that this data cannot be used by tech companies for social media profiling or something like that. And of course, the most controversial thing was about the role of the patients. As you know, in the proposal itself for secondary use, there is no role for the patients envisaged in terms of whether the data can be used or not. And here we had different positions in the parliament. So some political groups wanted to have a consent-based system. That would mean that if somebody wants to use a certain data set for research or innovation, then they will have to get consent from every patient whose data is part of this data set. Some, which of course would destroy the whole system. Some wanted, political groups wanted that we have an opt-in system. That would mean that those patients who want their data to be shared for secondary purpose would have to proactively go to the health data access body and give their consent again to opt in, but not for individual, for each individual case, but for all future cases. We also refused that because I believe that the data that we would get in the end would not be useful. There would be a lot of bias, because only those patients who want to practically be part of the system would give access to their data. And but on the other hand, we also wanted to have patients have a role in all of this, and this is why we went for an opt-out mechanism. So opt-out mechanism, so that those patients who do not want their data to be used for any reason can decide so. And we have now political agreement in the parliament of a general opt-out, with an exception, with an opt-in for genomic data and data from biobanks. Why this data? Because this data cannot be fully anonymized, and for that reason, so to have this increased level of data protection, so the majority of the parliament wanted to have an opt-in only for these two specific types of data, where the risk is bigger and where there is a need to provide additional safeguards for the patients. So that's the state of play now. There are many other things, but we don't have time to go into detail. Essentially, we have the political agreement now. After we finish all the technical details, we'll have the vote in the committees on 28th of November. In December, the plenary. I apologize. Then we'll start the negotiations with the council. With the council, we'll see what will be their position. They still don't have a common position. We expect that they will ask for additional funding to build the infrastructure from EU budget. We will support that. Also on the implementation, they will probably ask for more time for implementation. They will probably find some middle ground there. And on the opt-out, opt-in, the use of data, we still don't know what member states will do. What will be their common position. We heard some ideas that they want GDPR only to be applicable to these kinds of situations, so there is nothing on opt-out, opt-in, or whatever. I'm strongly against that, because knowing the different interpretations of GDPR in different member states, so we will have an enormous fragmentation there. So in some member states, they would probably interpret GDPR as requiring consent of patients every single time. In some other cases, they would interpret this as meaning that patients don't have to be asked at all. So to avoid this kind of fragmentation, different interpretations and implementations in different member states, I think the harmonized approach is good. I think the opt-out approach is the best way to strike this balance between, on the one side, the need to protect privacy and data, while on the other hand, also getting enough data that it is representative and useful. So thank you very much for inviting me. I hope I provided the most important information about the most contentious points in the parliament. There are additional things that we could discuss. Unfortunately, we don't have time for that, but if there are any questions or comments or suggestions, please send it to me, and we'll do what we can to answer all the stakeholders, as we did also up until now. So thank you very much.
Thank you very much, Mr. Sokol, for taking the time to really go really fast, but amazingly enthusiastically on the work that has been undertaken so far. I think this has given a lot of food for thought for both our panel and also the audience. To our audience, I remind that you can share your questions on the Q&A, and thank you very much for making yourself available, well, within reason and within time. As we know, work is tremendous right now over on your side to address some of these questions at a later stage. I have already informed everyone that unfortunately you can't continue with us for much longer, but stay as long as you can. Thank you so much for joining us. And bringing this important update, and I remember the words. You believe it will be possible to have this agreement and to have it all done by the end of the.
But it won't be easy. I think it won't be. We have 50-50 chance, let's say.
Okay. I will trust you'll make it. Over to you. My good friend Isabelle, and Isabelle, thank you very much for joining us. You are the Europe and International Director at the French Ministry of Health and Prevention. This is the Health Delegation. France is holding also the eHealth Network co-chair position, and it's my pleasure to invite you to share your perspective in a way, a little bit representing, not formally representing the council, but representing the position, the perspective of one member state, but I think with a lot of inspiration from discussions you're having with other member states on this important topic of the regulation and focusing on the exchange format. Thank you so much, Isabelle.
Thank you so much, Henrique, and I feel honored also by the invitation. I have to say that it's very interesting to hear Mr. Sokol and the position of the Parliament. Unfortunately, on my side, I won't be able to share what's going on the Council. This is the rules of procedure also during the negotiation process. However, I'm very happy to share our view on this very important topic, and I share the words of Konstantin to have a very positive approach. I believe that's something that we have in common, the three of us, is that we look at this vision of EHDS in a very positive way. It doesn't mean that we under-evaluate the challenges that we are going to face, but sometimes in life you have nice challenges to face. So maybe we can switch to the next slide. in terms of presentation. It means, therefore, quite a lot of vision for member states, because again, we are here going to work on, we are working on a regulation that will provide answers for citizens, but also for authorities, so to say, and for a lot of members of the larger health ecosystem. If we can move on. So I'm not going to repeat what has been said, but just in a nutshell, we have basically 3 sides in this regulation. One side related to the patient itself, one side related to the more to the industry and how to make the software and other digital devices compliant with the harmonization process. So it's basically a road to convergence. That is how we see it. And for the secondary use of data that has been explained, it's very important because we are building the European scale here, and it will change a lot the processes with a unique request for having a European reach on data, which is a game changer, I believe, for innovation, policymaking, and research. It will also translate in a strengthened governance for digital health within the EU, which is also something that will be a major change for member states. So we will have to, and I will come back to that, to synchronize, so to say, I like that word, between the national level and the European level. It is a journey. We are on board for a couple of years now, after some exploratory projects that were shown by Konstantin. We had a major also milestone on the way, which was already the cross-border healthcare directive back in 2011. And based on those work that have been provided over time, we had also the chance to be able to develop the EU digital COVID certificate. And I believe that if we were not on that EHDS journey already, it would have been a major challenge, and even bigger challenge, I would say, and almost impossible maybe to make it happen. And it has been a big success, as you all know, and we can actually build on that for making the new steps towards EHDS. We, as a member states, action, I would say, or footprint in EHDS by opening our national contact point back in 2021 with a first use case already live in France. And then during the French presidency, we tried also to put some steps forward in order to build EHDS. A first step was a more national one, but also maybe visible to the ecosystem with the adoption of SNOMED City as a standard. This decision had been, on pause for many years in France, and we were really happy to take this opportunity to demonstrate also our willingness to build the European health data space. Other steps that have been done, and maybe some humble ones, but however very important for the trust in EHDS, is the adoption of the European ethical principles for digital health. And we strongly believe that digital health is only used whenever trust is present. So it was very important to engage on an ethical journey regarding EHDS. And now we are also moving forward by hopefully being able by 2026 to exchange e-prescription. The first use case that we have is the consultation of the patient summary by the national health practitioners in France. And we hope to be able to accept e-prescription from other countries, and also make our e-prescription compatible in other EU countries by 2026, and we also, of course, are very much present for the secondary use of data, where we are actually piloting through the French Health Data Hub the development of health data at EU, which is the let's say twin of MyHealth at EU for primary use of data. So Health Data at EU will be also an infrastructure with contact points open on that. The pilot includes 17 partners coming from 9 countries and has been launched 1 year ago, led by France. And in 2024, we also hope to have this regulation being adopted. So that will be a tremendous step. So please, if we can move to the next slide. Then the current landscape now in terms of governance is indeed the EHDS network that is in place, where we, in terms of exchange format of data, where we also work on developing guidelines for the use cases that have been prioritized within the MyHealth at EU scope. We have other initiatives in place, and we already have several use cases that are really live, and some of them that are in process, and the ones that we have on the radar for the next wave. So it's very important to have this community moving forward and trying to collaborate. And when I spoke about synchronizing the national and European roadmap, this is through this community and collaboration that we actually can move forward. So if we move to the next slide. So in a very pragmatic way, we have also this double implementation, I refer to that usually, in place, that where member states do mobilize themselves to join MyHealth at EU, currently on a voluntary basis, and soon with EHDS regulation it will become mandatory. So that's the big change. However, many countries have already in their plan to join this infrastructure and exchange of data. It is organized in waves, and by 2027 we should have I believe 30 countries included. So not only the 27 countries from the Union, but also Norway, Iceland, and Ukraine who have shown up for joining EHDS. As Konstantin mentioned, on the next stages of EHDS, we will have also the opportunity to connect to other countries, non-EU countries, which will be also something different that we've already experienced in the EU DCC journey. So the 2 use cases that are actually live are the patient summary and e-prescription, which is very much linked to the e-dispensations, but we see also the opportunity to have for the patients a direct answer to their request to have their continuum of care and quality of care throughout Europe. This is really the aim that we are going to have with this double implementation, geographical and by use case implementation. Can we move to the next one, please? Thank you. So what does it mean? It will mean a change for the citizens and a change for the health professionals, because they will have the opportunity to benefit from this exchange of data. Citizens will have to give their consent in the case of the primary use of data whenever they are traveling and they want a health professional to access their data. But that means that if we want that to be a success, we need to make it work, and it needs to be used by both citizens and health professionals. So that means that we will have also a lot of communication, training, acculturation, and work on the changes of the ways of working for health professionals and the connection between citizens and health professionals. That will be crucial for supporting EHDS. So you can have the most beautiful infrastructure in place, the nicest processes. If they are not used, this is really a problem. And on that side, even if there is an expectation, we will have a tremendous work to make it happen. So next slide, please. Another side where we will have a lot of changes is the side of the software providers, because whatever the solution for that that comes out from the negotiation, they will need to be compliant with both European requirement and the remaining national requirements, because EHDS is not covering the entire scope of the requirements for health records. So also for software providers, you know, they have their development roadmap, so we need to ensure that we anticipate the changes they will have to include, and also have this the same challenge of communication, training, changes of ways of working, because the adoption of standards will take another road, and we will also have to make sure that the collaborative processes and the required transparency is part of this change management, in order to make sure that we have also here the required trust in the solutions that the software providers are putting on the market. Next slide, please. Then how do we get ready for that? In France, we have an interoperability framework called the CISIS. I'm sorry for this acronym, and setting the rules, and also trying to work in a very collaborative way with the software providers. We have experienced over time that it was a major key for success to have this collaboration between all parties. So we are actually working in very closely in order to make sure that the vision that we have will have you know, a footprint in the reality. So everybody needs to be ready, but if the technical solutions are not ready, you can't move forward. So that's really what's behind that. Next slide, please. So we are working on that side with representatives from healthcare, medical social professionals, and health information system publishers. That's really what we are doing, and we work on all the sides of interoperability, from data structuring and format to value sets, reference terminologies that needs to be used, and on 3 layers: business, service, and transport layers, which can achieve then the interoperability that is required. And we will have to synchronize that work that is done at national level with the European requirement. So we hope that we will start soon also to add this layer to the consultation process in France. So next slide, please.
Isabelle, I need to ask you to bring
to speed up.
to a conclusion.
So let's move to the next slide.
We have time for one or two questions.
Let's move to the next slide then. So having said that, we'll also have, of course, to adapt our national regulations, and a lot of also of additional regulations that are at national level will be to adapt it. We will also have new bodies in place and new processes for compliance, but not only for that, to access the data, for instance, for secondary use of data, and also in terms of communication to citizens and health professionals. So next slide, please. So what we believe is that this is a journey. It's a journey that will lead to further harmonization and convergence over time. So we are in the starting block. We have already put the first steps, but we believe that we need to turn to the future and look at the long-term process that we are going to take. So it requires a vision, it will require time, and as Mr. Sokol said, it will require also a little bit of funding to make it available. And when I'm saying a little bit of funding, of course, this is a joke, because it will be, of course, a very important investment. So having said that, we believe that we will make progress with concrete steps. And as soon as the healthcare professionals, the software provider, and the health professionals see the benefits with small steps, we will, in fact, have the key to success. Thank you very much.
Thank you. Thank you very much, Isabelle, for this comprehensive perspective, and also bringing us what France is doing, but also in a way how any member state that is responsible and is engaged with this discussion has to sort of warm up and prepare. We now have about 10 minutes for until the end. So I'm going to split it into 8 minutes for you and then 2 minutes for me to just quickly conclude. So Isabelle, I would ask you to rest for a while, and if you can have a quick look at some of the Q&A and have a look at one or two that you think it's more close to your heart, have a read them and check for them. But also, I would like you to think about, in like 2 sentences, what happens if we don't get this regulation? What do you think will happen to Europe? Konstantin, thank you so much for in 4 minutes attempting to address the so many questions that some of them were directly targeted at your presentation, others are not. I rather than ask you to comment on all of them, because I think it's a little bit impossible, I leave you to make that sound judgment on what you think make more informative for our audience. Over to you.
No, thank you very much for the questions. I'm just looking at them. There is one question about the possible integration between My Health at the EU with health data at the EU. So as I mentioned already, first of all, the use of the format, the harmonized language within the primary use is going to be also beneficial for the secondary use, and the possible interaction between the infrastructures is likely to happen between the national contact points for digital health in primary use and the health data access bodies in secondary use. So I hope that the possibility to consolidate the data and make it available for healthcare purposes across the border would be also useful for supplying some of that data to the health data access bodies. But direct other interactions are not at the moment planned between the two infrastructures. They are for different purposes. So we are exploring the possible synergies, but not at the moment connecting the two. There is also a question about the implementation of the e-prescribing and e-dispensing functionality, which supports the cross-border workflows. What is the connection to the format itself? I think when we speak about the format, it's not just one way of saying this is the prescription and that's it. The format might have multiple profiles, and at the moment, a joint action is being launched to actually examine the elements of the format in more detail and to prepare specific certification-related requirements for EHR systems. So what we see cross-border, the use of the format for cross-border e-prescription, e-dispensation, it might be slightly different when applied at the level of the EHR system, but it's not about saying that it's an incompatible profiles of the format. No, it's more about taking a different angle. It's the same e-prescription functionality and asking oneself, so what do we need for cross-border and what do we need at the level of the EHR system, for instance, to support the possible transmission of that e-prescription later on cross-border. Maybe it's at the level of coding, maybe it's the level of sufficient granularity for being able to convert into the format, etc. So that is going to be examined in more detail in the joint action.
And can I ask you also, before I hand over to Isabelle, sorry, we have so little time. I was reading all the questions now. Let's make a sort of a collective promise to address them in the forthcoming summit on the 12th of December. Everyone's invited to join online at least. But what happens if we don't get the regulation? What if we don't get it in June? We don't get it in April. We don't get it. What happens according to you?
To summarize, maybe so the problems are going to stay, and people will keep trying to resolve them. Unfortunately, these attempts would be not as efficient as with the existing EHDS regulation. So
basically, we will have the problems and spending money on trying to address them in non-harmonized,
non-efficient way.
Non-efficient way, and that's the concern of the Commission as you step up for the proposal. Thank you so much. Isabelle, over to you to address, well, whatever you can in such a short time. Not escaping your also hard question. I give you 3 minutes. I need just one to wrap up.
Maybe, and this is probably something which is less crucial in France, but you know that also there are many countries where there is a lack of interoperability across the country itself. In France, we are currently trying to solve this as much as we can. So between health professionals for us, because we are quite a centralized country, but there are countries that are more regionalized. And so the regulation will also break, let's say, the barriers of interoperability or lack of interoperability at a national level. So I fully agree with Konstantin. If we do not have the regulation, problems will remain. It will take more time. And to a certain extent, I believe, and I see that even with my young ones, that they do not understand why it is not yet in place. Because when you are traveling abroad, you do not understand why you cannot benefit from a quality of care due to the fact that the health professionals cannot access your data, and this access is granted only with your consent, by the way. Again, so they do not understand. So I believe that we really need to have that answer to this problem. And for the research side, each of us would like to benefit from the levers that will be provided by creating this European scale.
You still have 2 minutes. Can I fire back at you one question from one of the audience? Is worried that the existing standardization profiling organizations, so the mechanism itself, is too slow to adopt new technologies in interoperability. And I know you've worked also with industry partners very closely. How do you see the speed at which we are progressing compared with the speed you just mentioned in other sectors and digital, digital transformation in general? How do you see we are doing? Showing the waves.
Yeah, but we need to be careful about talking about speed. Of course, everybody is very enthusiastic and so on, but it requires a lot also of changes. And as I said, industrial companies also need to adapt their roadmaps and so forth. So first, I think the critical question is that how a standard is being adopted, and then having the decent time to make it available. But there are lots of push to accelerate, but you cannot go also too quickly, because otherwise your healthcare providers and all the entire ecosystem doesn't get the decent time to get adapted to the new changes. But over time, the more we go forward, the more efficient I believe it will become, and the more we will go on a convergent journey. This is at least how we see it. But currently, as I said, even at national level, we have already, we are still stuck sometimes with a lot of things. So we need to leave some time for making things happening. So, but of course, we are very enthusiastic about making them happening.
Thank you so much. Thank you both for this quick but very interesting discussion. The time is running short. We have 1 minute to finish. I really want to thank you, thank all of you that attended our webinar today, and thanks our team that has set up everything so that we could be enjoying ourselves and making sure we have this recording that will be made available to everyone. And slides and presentation slides will also be made available. I want to also extend my invitation for everyone to keep following the XpanDH project website, especially because, and also our social media, especially because we are announcing more details on the future 12th of December European Electronic Health Record Exchange Format Expert Summit. This will be a hybrid event in Brussels and online, and we still have some room spaces so people can express an interest to participate in person. This will be subject to some, I wouldn't say evaluation, but some consideration depending on the available space, but also available online for everyone to enjoy and participate. So this is going to be on the 12th of December between 9 and 6 p.m. And of course, we will continue to update you with more on the project, on the format. And of course, this was today a very interesting discussion on the basis, the real regulation that would be the basis of furthering this work, as everyone mentioned, that seems to be crucial for Europe in this day and age of digital transformation. Thank you so much and have a nice afternoon. Thank you.
Thank you. Have a nice evening.
Thank you.